Canamero is on your side with what mental health counselors are saying.
We've seen the testing lines, and we've seen how this virus has impacted families who've lost a loved one.
But I think what exacerbates it is that there's an uncertainty as to when this is going to end.
Dr. Tracy Polson, a licensed clinical social worker, knows the potential impact on one's mental health. People are exhausted.
And I'm concerned for a lot of people.
Now she knows the physical impact of COVID-19 as a patient. Recently, she was diagnosed with the virus.
We were pretty much flat on our back.
In 8 months, the COVID-19 pandemic has changed how we work and how we socialize.
We're social animals by nature. And so being with friends and being with family and going places and doing things, those are things that are a little riskier right now.
Now it is affecting how we celebrate our holiday traditions, Thanksgiving and Christmas. Polson's advice is simple: adjust your plans.
If we're careful. And so smaller gatherings, getting tested ahead of time.
In other words, do not let COVID-19 fatigue take a toll on your state of mind.
We are collectively going through a huge traumatic experience.
Stephanie Payton, also a licensed clinical social worker, like Polson, says to cope, you have to be creative.
If people have some type of spiritual or faith belief, then that can absolutely be of benefit.
Use technology if you have to share time with family during the holidays.
Look at doing a different tradition.
While the moment seems filled with uncertainty, Payton reminds us there's a vaccine before us, and COVID-19 will one day be behind us.
Remember that this is a temporary state that we're in.
Canamero, First Coast News, on your side.
Good advice to remember.